And then the next thing we'll talk about is culture. After culture, we're talking about spirituality. And so while I'm doing this, I do want to give a self-disclosure. I am not by any means professing to be an expert when it comes to spirituality. But I do want to still talk a little bit about just how vastly different perceptions are when it comes to what happens with the afterlife. And it's helpful for us to be aware, especially when we're working with our clients. It's very helpful for us to be aware of their spiritual orientation. And even taking a step back to talking about culture, it's helpful for us to be aware of what culture they're coming from, how they mourn in their culture. And we're going to talk about narrative therapy that does give space to culture. And to giving an opportunity for people to acknowledge how society impacts how they express as well. And so it's helpful for us to be aware of these things because we can give some psychoeducation to our clients, especially clients who are coming in from another culture or from another spiritual orientation. We can give them psychoeducation on, well, this is how some people in some cultures grieve and mourn, so you're not alone in this experience. And again, it's about normalizing our experience with our clients. It's about normalizing their experience and normalizing that they're not alone in being a subculture here in the US. And so let's go ahead and dive into spirituality. So the first one is Buddhism. And so Buddhism comes from this concept of reincarnation. So basically, the concept is that death is natural, it's inevitable, and we each have a spirit. And when our physical body dies, the spirit is then reborn into a new life here on earth. And so with Christianity, the concept is that everyone has a predestined time, day and time of death, and we all have a spirit. And when the physical body dies, the spirit either goes to a place of perfection or a place of suffering. And some individuals believe that there's also this in-between place. And so just under the Christian umbrella, we can hear that there's different beliefs. So just because a client comes in and says, yes, I'm a Christian, it's important for us to not assume that, oh, okay, this is what you believe. It's important that we ask those questions. Well, what does that mean for you? Because it's different for everyone. Some people might believe that there's this in-between place. Some people believe that there's this place of perfection. Some people believe there's this place of eternal suffering. So again, it's about meeting our client where they are and asking them those questions instead of assuming. And the next one is Islam. And so with Islam, they believe that Allah decides where the person dies. And then within this particular one, we all have a physical body and we stay buried. And then when the day of judgment happens, that's when we either go to a place of perfection or to a place of eternal suffering. And so with atheism, it's more about freedom to adopt whatever belief system we want to believe in. So if we want to believe in an afterlife, we believe in an afterlife. If not, perfectly fine. We simply cease to exist. And then if some people want to believe that there's this eternal resting place, or our soul stays here on earth and is reborn again, then atheists are free to believe that. And so again, the reason why I wanted to really hone in on this section is just to show, again, the vast differences within spiritual orientations. And so again, not assuming that because my client is atheist, this is what they believe, because they're Islam or Christian or Buddhist, this is what they believe. It's important that we ask our clients, what is your belief system? And it's also important to be mindful that not all individuals are as connected to the belief system as others. I'm sure we can think of our own families, our own friend circle of friends, how maybe they are Buddhist and some are more connected to their different rituals than others. Same with Christianity. Maybe you know a group of Christians and some are more engrossed into their spiritual belief than others. So just because, again, someone comes in doesn't mean they're going to be as connected to the spiritual belief as someone else. So it's about meeting our clients where they are in these moments. And again, when we go into narrative therapy, it does give an opportunity to really truly hone in and explore some of these experiences that they have within their own spiritual belief system and their own culture as well. All right, so the next thing we'll talk about is development. So when it comes to development, I thought this statistic was very helpful. It says 1 in 14 children, which is 5.3 million children in the US, will experience the death of a parent or sibling by the age of 18. And this statistic was done in 2021. But 5.3 million, that is a lot of people. And I'm sure it's definitely gone up due to COVID, but 1 in 14 children. So thinking about, for those of you who work with children, we are going to talk about some interventions later on, but think about the children that you work with. As we're going through this, see if you can identify some experiences that they may have that might be concerning, that you might need to explore a little bit more of. And so the first age group that we're going to talk about are babies, ages 0 to 2. And so when it comes to this particular age group, it's more about separation anxiety. So babies are aware that there is an entity, a being, a presence that is no longer there. And so because they're aware of this, they can experience separation anxiety. And at this time, it's many times this longing to be around another adult. And so this is important for parents to give a lot of physical affection, a lot of eye contact to their child at this time. Another one is changes in feeding and sleeping habits. And so this one can be very challenging for some families because let's say it's a parent who died, and now the other parent is a single parent taking care of other children and a baby or a toddler. And so they might have someone else come into the home for a little bit to help them. And that other person may not know the child's eating habits, may not know the child's sleeping habits. So that communication is not relayed. And the child could be grieving and nobody knows because that information is not relayed. The person coming into the home isn't sharing, yeah, they just slept this long or they didn't sleep this long. And the parent isn't sharing, this is how long they usually sleep. This is how much food they usually eat. So sometimes it can go unnoticed when a baby is grieving. And the next one is increased distress. That's quite common for a lot of babies. So that's why routines are very helpful. Being consistent is very helpful. And you're going to hear me repeat that quite a bit throughout the different age groups. Routines and consistency is very crucial when giving support to children who's lost a loved one. The next one is preschool age, ages 2 to 4. And so this is all about vocabulary, being mindful of the vocabulary that we're using with them. And so they'll ask a lot of questions about where's mommy, where's daddy? And they'll ask over and over and over again. And when it comes to vocabulary, it's about avoiding euphemisms because they don't understand that. So when someone says, oh, they passed away, or, oh, we lost mommy, the first thing is we lost mommy, well, let's go find mommy. Or we lost sissy, well, let's go find sissy. So it's important to, again, stay away from euphemisms and try to use concrete language, such as sissy died or daddy's body stopped working. Those are very concrete language that they're able to understand. The next one is anxiety. Anxiety is something that definitely happens quite often. So they might become more clingy or need to be held more often. Many times, again, consistency and routines can be helpful when it comes to that aspect. Sometimes they might feel abandoned. They might feel that they're unable to do certain things that they're able to do. So maybe they used to be able to tie their shoes, learning how to tie their shoes. Now all of a sudden they may not remember how to tie their shoes, and they might need extra help getting dressed as well. So kind of preparing parents for those experiences, for those signs, so that way parents can mentally, emotionally prepare themselves to be more present with their child and to understand that the child might become more needy in those moments, might become more clingy as well in those moments. And then repeating the story, reminding their parents that they might have to have the story repeated multiple times. Maybe there's a routine that the child's used to. Maybe dad was the one who picked them up from school, and now mom's picking them up. So child might ask, where's dad? Where's dad? Every day after school. And so just keeping the parent in awareness that might happen can be helpful, because it can give the parents some coping skills that they can use before picking up their little one to kind of help with expectation And then after, repeating the story of daddy's body doesn't work anymore, so daddy's dead. It can help the parent also figure out some coping skills that they can use after talking with the little one about it, so that they can continue functioning as parent as well. And then the next one is elementary age, ages 5 to 9. And so this one is more about them understanding that death is irreversible. And they are slowly getting to the point of being able to fully understand that death is final. Many times they do have some strong emotional reactions, or they might revert to nothing has happened. And when it comes to responsibility, many times they feel that they are responsible for the cause of the death. So for example, let's say a child who's 5 to 9 years old loses their dad in a car accident. The child might say, man, it's my fault. If I had been in the car with dad, I could have warned him about the oncoming truck. Or if I had been in the truck with dad, I could have talked to him so he would have stayed awake and wouldn't have crashed off the side of the rail. So they put themselves in those situations. If I had been there, then I could have saved them. If I had been there, then I could have done something and they would still be alive. So they put that responsibility on their shoulders. And so again, it's about educating our parents and working with our parents and helping them to know that this could be a possibility, and helping give our parents language to communicate with their loved one, their little one, about how responsibility is not on their shoulders. And also during this age range, it's helpful for us as clinicians to definitely work with them, but it's also helpful for us to have family sessions as well, so that we're all on the same page. It's important to have parent-only sessions every once in a while. So you can start with the language. What kind of language do you want me to utilize with your child? Or even helping the parent who may not know what language to use, help them to identify this is helpful language to use with the little one. And then having a family session can be helpful as well. And then kind of going back to spirituality. Whenever we are having that one-on-one session with parents, asking our parents, well, what spiritual orientation do you guys come from? Is this something that's discussed in the household? How do you want me to handle this whenever it's brought up in session with your little one? When they're asking about what happens after death, what spiritual orientation do you identify with that you'd like me to come from? So having those conversations can be very helpful when working with children. So I definitely encourage you guys to definitely have those conversations as well. And then while we're working with them in session, it's definitely important to do a lot of play as well. Some people might turn to play therapy to help the child process. Some people might turn to art therapy to help process as well. So the next age that we're going to talk about is middle school, ages 10 to 13. And so this here is more about peers. What do my peers say about me? So they see life through the social lens. And so for some, they may want their peers to know what's going on, and others, they may not want their peers to know what's going on. And so it's important that we talk with our clients that we might work with in this age range and asking them, how do you want your friends at school to interact with you? How do you want your friends in your neighborhood to interact with you? And so by us asking those questions, it gives them the opportunity to not only express, but also be able to help us to know how to relay this information to mom. So there's a documentary that happened several years ago in the UK. And basically what it was talking about, it interviewed teenagers and young adults who had lost their parents. And one of the two of the girls, their sisters, they had shared their story about losing their dad. And they went to a private British school, and it was an all-girls school. And they were talking about how when their dad died, they had stayed home for a couple of weeks, and they had gone to school, and none of their friends wanted to talk about their dad. Even when the oldest girl had tried talking about her dad, her friends would quickly change the subject. And she felt isolated. She felt alone. And fast forward a few years, she ended up talking to her mom about it, and come to find out, when the dad had died, the mom had told the teacher, hey, this is what's happened with the children. Just kind of let the children know at school that this was going on. Well, the teacher relayed that as, okay, we're not going to talk about it. So the teacher told the children, this is what happened to your classmates. They lost their dad died. and we're not going to talk about it. And so there's just a loss of communication that happened, resulting in the girls having a very isolated experience after their dad had died. And so it's important that, especially for those, I know several of you guys had mentioned working in the community, working within schools. And so for those of you who do, it's very important that we sit with the child and ask the child, how do you want school to look for you? How do you want your peers to interact with you after this? And then relaying that to the parent, relaying that to the school, if you have access to teachers, relaying that to teachers, or even most schools nowadays have a school counselor. So relaying that to the school counselor, and then sharing that with the students, or even having the child, if they choose to share that with the students, they can. I know for myself, several of the teenagers that I've worked with, we've had those conversations. How do you want life to look like when you do go back to school? And interestingly enough, majority that I've worked with say, I don't want my friends to talk to me about it. Only if I bring it up do I want them to talk to me about it. And thankfully, that was the case. We were able to relay that message, and the children, they kind of avoided it. And if the child brought it up, the friends were more than happy to talk about it and to give hugs and lots of encouragement, or even have the child walk with the child to the school counselor if that was needed in the day. And so the teachers were aware of it. So the teachers knew, okay, I see something going on with the child. Let me see if they need to go to the school therapist or school counselor. So definitely getting the teachers involved can be very helpful when helping children who are in school. And then suppression definitely does happen quite often, sometimes for some. They don't want to talk about it. There could be changes in their mood. They just don't want to go some places anymore. Sometimes even fear of losing another parent can pop up. And then they have this fear of, well, what's going to happen to me if I lose my other parent? Where am I going to go? And so sometimes having those conversations with parents, finding out their fears, and then having those one-on-one conversations with the parent to see if the parent even has a goal or an idea in mind of what could happen to the child if something were to happen to that last parent. And then having that family conversation of, okay, so this is what would happen. This is where you would go if something were to happen to this last parent. So it's about easing some of the fears and uncertainties that some of our middle school students might go through as well. And then also during this age group, joining a supports group can be very helpful. Thankfully, in a lot of schools, they're starting to do grief groups. And so that might be something to look into. If your school has a grief group, seeing about enrolling your child that you're working with into that grief group, or even starting a grief group as well. But there's a lot of camps as well. I know summertime's coming up, but there's a lot of camps as well that help. There's some camps that are animal oriented. So they do a lot of animal therapy as well. Some camps are geared more towards music. So they do music therapy. Some camps are geared more towards art. So they do art therapy. So definitely finding those resources within your local area that would be helpful for your middle school students, even high school students. They have camps for high school students as well. Let's kind of start with high school. So high school is 14 to 18. And so this is more about existential questions will arise. And then this concept of justice and fairness will arise as well. And also during this age is about self-esteem. So if the person who died, so let's say it's a female, and it was their mom who died, and they identified a lot with their mom. They had a really deep connection with their mom. If their mom died, then sometimes it can cause them to have a challenge with their identity, and they begin to struggle even more because they identified with that person a lot more. So meeting our client where they are and asking them, how close were you with this parent? How much did you identify with this parent? What was your relationship and connection like with them? And just sitting with them in those moments as well. And so depending on the relationship, sometimes there could be some guilt associated with it. Again, going back to the younger age of, well, why did this person have to die? Why them? Why now? Why me? Questions might pop up as well. Sometimes behavioral concerns can pop up as well. Because of this age, they many times do have easier access to substance use, whether it's because of driving or because their friends are driving, or there's just more freedom to be able to go out. So kind of being mindful substance use as well, checking in on that from time to time, seeing how if that's become a factor in their life. And of course, we're going to talk about some coping skills to help so that way, hopefully they don't go down that path, but also being mindful of substance use and the access to it as well. Right, the next one is young adults, ages 20 to 40. And so during this age, it's about identity as well. So kind of thinking about a parent who's lost a child, and they begin to question, well, am I still a parent? Can I still, Mother's Day was just recently, can I still celebrate Mother's Day? Can I still celebrate Father's Day, even though my child's dead? Even thinking about the parent who's lost a teenager, and going through that struggle of, well, what do I do with their clothes? Do I give them away? Do I keep them? And even in losing their child, they're also losing the possibility of having a grandchild, because maybe they only had one child. So now they have to mourn, I'm not going to be a grandmother as well. I'm not going to be a grandfather as well. And social connections are sometimes impacted as well. There could be maybe a group of moms got together, a group of dads got together, or a group of couples got together and the children hung out. And now that their only child is gone, now they have to question, do I really want to still go in that social circle and see my friends hang out with all their children? Because that was what connected us, was our children. We all were on the same soccer team. We were all on the same orchestra band or something. That's what connected us. So social circles, social connections begin to change because of the loss of a child. And so sometimes there is this emptiness that can come up for a lot of people. And it's important for us to be mindful of those secondary losses that we talked about earlier, and visiting those secondary losses with the families and the couples and the adults that we're working with. The next one is middle age. This is ages 40 to 60. And so many times there could be a lot of guilt associated with this. Sometimes we get caught up in life, and there could be concerns about, man, I wish I had spent more time with them, or I wish I didn't do this, or I wish I had the opportunity to talk to them. Whether it's a parent, maybe a parent has died and they wish that they had a better relationship with them, or a child has died, I wish I had told them I love them more. Or it could be a spouse. And so kind of thinking about the spouse, the second one, secondary losses regarding future retirement. Maybe the spouses had this goal of, this is what we're going to do when we retire. And now that their partner is dead, they now have to rearrange their whole entire plan when it came to retirement. So it's definitely a lot of secondary losses that can present themselves at this age. And then, again, keeping in mind that as time goes on, many times when someone experiences a loss, it can trigger a previous loss as well. And so by this age, many times there has been multiple losses. So keeping that in mind as we're working with clients in these age groups, that it could possibly trigger a previous loss. Okay. So the next one is elderly, ages 60 to 70, or 60 and older. And so the same thing, multiple losses. So it can definitely trigger previous losses. And it doesn't, again, it doesn't have to be death. It could be loss of a job, loss of health. Health many times is deteriorating for some, and loss of independence because of loss of health. And because of loss of independence, it can also become loss of social roles. Maybe they were very active in the community, and now their children are putting them into a space where they can't be as active in the community. So loss of social roles as well. And we're going to, again, talk about narrative therapy, how we can just sit with people in these moments and let them process, what is this like for you? I know there is this one training I was doing, and a person had shared with me how their client had experienced so many losses that they were literally the only person still alive. All their family was gone, their friends were all dead, and it was a very lonely experience for them. And so sometimes it's about sitting with our clients. Again, going back to what Dr. Elizabeth Kubler-Ross says, it's not about saying, well, just feel better, or look at the sunny side of things. Sometimes it's about sitting with our clients in that sadness, and letting them express that sadness as well. Next one is dependency. I talked about it just a moment ago, very briefly. Dependency is loss of a partner, a loss of health as well, can definitely be impacting in someone's life. And so as we talked about each of these different stages that people can go through, it's important about us normalizing these experiences, normalizing that grief is very complex. It's very challenging to go through for many, but it can be worked through. And it's about taking one moment at a time, one experience at a time as well. And I also want to briefly mention this concept of therapy when it comes to working within these different age groups. There is no one size fits all. It really is different for every age group. And it's about meeting them where they're at in their experience. And it's about supporting them and asking them what is it they need in this present moment. What are the things that we can do to create a healthy environment for you, a healthy space for you as well. And so now we're going to go ahead and do some Q&A. And so I'm going to stop my screen share to see if we have any questions.
All righty. I have some that I pulled out while you were presenting, so I'll just drop them back in the chat. So they're right there for you. And
oh, nice, wonderful, thank you. So the first question is, how does the impact of multiple losses differ for cumulative grief versus traumatic grief? Yeah, so when it comes to cumulative grief can actually become traumatic grief because it's loss after loss after loss after loss. So that people can definitely experience multiple griefs at the same time. So for example, someone can experience traumatic grief and distorted grief. So again, traumatic grief is whenever someone experiences or witnesses a traumatic loss, to where distorted grief is when someone becomes really angry or feel a lot of guilt and engage in maybe self-harming behaviors. And so they can definitely experience both at the same time. And so how would that look? That would look, maybe they witnessed someone's loss, and maybe the people that did the harm to their loved ones was of a specific gender. So now they have a lot of anger and hatred towards that gender. Or it could be a racial group or a country even, with everything going on nowadays. And so we could definitely experience two at the same time. It doesn't always have to be the same. Another example, cumulative grief, the one that you had asked about, and disenfranchised grief. So some can have multiple losses, and maybe one of the losses is cyber loss, and people don't really acknowledge cyber loss. So they then become experiencing disenfranchised grief. So you can definitely experience two at the same time. Yeah. In the Hogan Grief Reaction Scale available for free? If not, how much does it cost? Which is the scales for free? Yes, some of the scales are free, some of them are not. I would encourage, so for those of you who work in an office, I'd encourage connecting with your front office, because many times they have resources on getting some of these scales that we talked about today. For those of you who are private practice, it can be more challenging. And so each of those scales are in different locations. And so what I can do, I can actually, can I post in the chat? Can I do that? Okay, so during the lunch break, I'm gonna post the actual places you can go to get some of them, and then you can see which ones you wanna get that are cost, which ones that you can get that are free as well. Yeah, great question.
I can also, just to jump in, when I send out the PowerPoint to those, because again, I'm going to pull the list of everyone that's here off Zoom and send out the PowerPoint, I can take what you post in the chat and sing that along.
Nice, wonderful, great, good deal. And which screening assessment tools require the provider to be licensed? Again, the links that I'll share with you, it'll share which ones are for which license. Yeah, great question. For the grief groups, you run? What assessments do you use with participants? Actually, for my grief groups, I typically don't do assessments. I know some people do, it's different for everyone, but I typically don't. I know some people, they might do the Hogan grief reaction scale, because it helps range between what happens before, during, and after treatment. But again, it's different for everyone. I'm more of an intervention type of person, so I focus on the interventions that we're doing, and checking in to see how people are doing in that moment. Yeah, great question. Good questions, you guys. Okay. All right. And so the first half of the training, we talked about just understanding grief, the different types of grief, how to conceptualize it, acute grief, integrated grief, complicated grief. And now we're going to focus on therapy. We're going to focus on counseling. We're going to focus on how to give support to our clients. We're going to focus on the grief models and the different types of theoretical orientations. And we're also going to be discussing the different interventions we can use as well. So before we dive in, I do want to read an excerpt from On Death and Dying by Dr. Elizabeth Kubler-Ross that I thought was very insightful for her to share. She said, some patients postpone the confrontation for a while, only to ask us the next day or the following week to come and sit with them. It is well for those who are trying to do this kind of work to remember that a quote unquote rejection by such a patient does not mean, no, I do not want to talk about it. It means only, I'm not ready now to open up to share some of my concerns. If visits are not discontinued after such a rejection, but are renewed, the patient will give the cue when he is ready to talk. As long as the patients know that there is someone available when they are ready, they will call at the right time. Many of these patients have later on expressed their appreciation for our patients and shared with us the struggle they had with themselves before they were able to put them into words. And so I want to encourage you guys to keep that in mind. Maybe there's a client that you're working with or have worked with in the past, and they seem to keep rejecting and pushing away and not wanting to talk with you. Keeping in mind that sometimes they may not be ready. It's not a reflection of us. It's just maybe there's some internal things that they need to work through before being able to find the words to share with us what they're going through. I thought that was very insightful and helpful for her to share that. And so now we're talking about grief counseling and grief therapy. So there's a difference between the two. I know many times we hear those terms used interchangeably, and there are a lot of overlaps. Many times there's interventions in both. The focus is on helping our clients reach and maintain a healthy space, mentally and emotionally. But the main difference is that with grief counseling, it's more short-term, and it's usually embraced when normal grief is happening, kind of going back to what we talked about earlier today, normal grief. To our grief therapy, it's more long-term, and it's usually because there's some type of complication that's happening within the grief therapy process or grieving process. And it goes back to those different types of grief that we talked about before. They're experiencing one of those type of griefs. And many times there's also another diagnosis associated with this. So sometimes it could be depression, or it could be PTSD or a substance abuse as well. And so sometimes there's some underlying issues going on, some unresolved issues that we might need to explore as well. So that's why it's many times longer than grief counseling. So the first model we're going to talk about is companioning model. Companioning model is by Dr. Alan Wolfelt. If you ever get an opportunity to hear his story, I definitely want to encourage you to do that. He's a very astounding and interesting man. He had experienced a death of an associate of his when he was 19 years old, and it resulted in him writing and publishing his first book at 19 years old. And the book is about teenagers who are grieving and what they're going through and how to help them. And since then, he's written over 40 books. So he's a very well-known author as well. And so this is the model that he created. And so the first one, and so while we're going through this, I do want you to think about your clients, who they are, where they are in the grieving process as well. So yeah, let's dive in. So the first one is companioning is about being present to another person's pain. It is not about taking away the pain. Companioning is about going to the wilderness of the soul with another human being. It is not about thinking you're responsible for finding the way out. Companioning is about honoring the spirit. It's not about focusing on the intellect. Companioning is about listening with the heart. It's not about analyzing with the head. Number 5, companioning is about bearing witness to the struggle of others. It's not about judging or directing their struggles. So just for a moment, I want to check in with you guys. What kind of sticks out to you guys the most? I'm going to see if I can pull up the chat. But which ones out of these 5 stick out to you the most? Which ones do you identify with the most? I know for myself, number 1, definitely, companion is about being present in another person's pain. It's not about taking away the pain. Yeah. And then I know some people are saying number 5, companion is about bearing witness to the struggle of others. It's not about judging or directing their struggle. That's a good one. Someone else said number 4, it's about listening with the heart. It's not about analyzing with the head. Yeah. Thank you guys for sharing that. Yeah. So we're going to do the last set that he shared, number 6. Companioning is about walking alongside. It's not about leading or being led. Number 7, companioning means discovering the gifts of sacred silence. It does not mean filling up every moment with words. Number 8, companioning the bereaved is about being still. It's not about frantic movement forward. Number 9, companioning is about respecting disorder and confusion. It's not about imposing order and logic. Number 10, companioning is about learning from others. It's not about teaching them. Number 11, companioning is about curiosity. It's not about expertise. And so I'm checking with you guys, which ones out of those kind of resonates with you the most? Number 10, companioning is about learning from others. It's not about teaching them. Yeah, definitely. Because everyone grieves differently. So it's about learning how they're grieving. Yeah. Number 6, companion is about walking alongside. It's not about leading or being led. Yeah. It reminds me of a training I had gone to several years ago. I think it was a trauma training, and the person was talking about this concept of counseling and therapy, and how many times our clients will come in and say, all right, tell me what to do. Tell me how to handle the situation. And so he explained that sometimes it's about walking to a dark room of our clients, and all we as therapists are doing and supporters are doing are shedding light on different corners of the room. And because we've been in similar rooms so much, we kind of know which corners to kind of look into and which areas to look at. And all we're doing is shining light, walking next to our client the entire time, and just pointing out, oh, look at that over there in the corner. And our client exploring it for a little bit and looking at another corner, another part of the room. That really resonated with me. That's what made me think of that when you said number 6. Some people were saying number 7. Companioning means discovering the gift of sacred silence. It does not mean filling up every moment with words. That is very powerful. Because think about it, our clients interacting with family members and friends, they talk about their loss, they talk about their grief, and what do most people do? They want to chime in and say something like, yeah, I've experienced that before, or I remember this person, or you just got to move on, or got to just keep going forward. They always want to, many times people want to say something, but sometimes just sitting in silence can be very, very powerful and impacting. It reminds me of one time when I was in high school, me and a few friends went up to Canada to go skiing. And still to this day, I have no idea what happened. But one of my best friends, we walked off a little bit from the group, and I could tell she just felt sad. Something had happened. She just felt down. And so we walked off and we sat on some benches, and we didn't say not one word. We just sat there. We probably sat there for maybe 10 minutes. And then she said, okay, I'm ready to go. And she was her happy, cheerful self again. And we said not one word that entire time, but just having someone's presence there made a difference. And that's the same thing with our clients. Sometimes they just want a person's presence, not words, just a presence. It can be very, very impacting and powerful as well. Yeah. And it can be uncomfortable at the beginning. I remember in grad school, I know every grad school program is different, but in our grad program, we did quote unquote, mock counseling sessions. And there were times where our professor would be in our ear telling us, all right, just sit in silence with the person. And it was a little uncomfortable at the beginning. But as you practice and get used to it, it can actually become very comforting yourself. And not as awkward, definitely. But a lot of this that we're talking about, the more we practice, the easier and better it gets as well. The next model we're going to talk about is complicated grief treatment model. For those of you who are familiar with TFCBT, you're going to find a lot of similarities. It is very, very structured, the same way as TFCBT, trauma-focused cognitive behavioral therapy. And so it has 4 phases and then 7 modules. And so as we're going through the 4 phases, you'll hear the 7 modules being implemented in the 4 phases. So the first phase is getting started. So this is where assessments are done. This is where case formulations are done as well. And this is also a lot of psychoeducation is given about complicated grief. This is where we let the clients know that it's usually anywhere between 10 to 20 sessions going through this particular model. And also during this time, we are doing some emotional regulation work. And here, after we talk about the different models and theoretical orientations, we are going to talk about some interventions and the importance of doing emotion regulation work. And then also during this place, we're also helping our clients build a social support, a social connection, reconnecting them to the things that they were once interested in before they experienced the loss. The second phase is revisiting the death. And so this is usually between sessions 4 and 9. And this is where the memories and the stories of the death are explored. And there's many different ways it can be done. It could be done through drawing. It could be done through journaling. I've had some clients do it in a book form. So chapter 1, this is what happened. Chapter 2, type of form. I've had a couple of clients do a comic strip, literally with the boxes, doing a comic strip, and that worked for them. So there's so many different ways of doing this particular section. And then of course, during this, we're also doing emotional regulation as well. And then the next one is the mid-course review. So this is usually around session 10, and this is where progress is explored. We're seeing how well they're doing, if there's other areas they're ready to focus more on. And then we'll also talk about what do the rest of sessions look like? What does therapy look like after sessions? And then the closing sequence, that's around session 11 or 16. And the phases, this particular phase is more focused on any other types of losses that might want to be explored. That's when we do that at this time. So it's a lot more flexible. It's not as structured as the other ones. And we also talk about how, again, life is going to look after therapy and the rest of their grieving journey as well. We review the progress that they've made. So as you can hear, it is very structured. Like I said, just like TFCBT, very structured. Each session has a specific task that you're focused on. There is homework in between each session as well. So the next one we'll talk about is task-based model. So task-based model is by William Worden, J. William Worden, and he basically spells out the word tier. And so the letter T means to accept the reality of the loss. And so here he talks quite a bit about the concept of denial, how denying the loss can have some benefits. It can help take kind of the weight off of our shoulders for a little bit, so the person is able to function in life and go about their daily life as they need to. So he does talk about the benefit of denial, and he also talks about acceptance as well. And then the next one, he talks about experiencing the pain of the loss. So this is when we're transitioning from denial and focusing truly on experiencing the pain. And so just for a moment, kind of thinking about our culture and the environment that we're raised in, whenever we're faced with something that's challenging, for many people, we avoid it. Whether we avoid it through substance use, through entertainment, reality TV, gaming, become workaholics, medication. We try to avoid whatever pain or challenges you might be experiencing. So coming from a culture like that and then coming into therapy where we're saying, hey, let's explore your pain. Let's dive in and see what your pain, how much pain you're experiencing. It makes sense why some clients might want to avoid it. And then other times we get clients who are ready to express their pain and let it out. So again, it's about meeting our clients where they are, and understanding our role. Our role is to be supportive and be there for our clients when they are ready to express. And it's reminding our clients that we're going to be with them the entire way. We're going to be walking with them through their entire grieving journey. And many times, again, psychoeducation will be helpful during this place as well, giving them psychoeducation, again, on the benefits of denial, and also helping them acknowledge how avoidance plays a role in their healing journey. How sometimes, for example, someone had talked about cumulative grief earlier. If we have loss after loss after loss, and we come to therapy exploring these losses, sometimes we might need a transition out of therapy. And when we transition out of therapy, going into daily life, we might need to put on some blockers again so we can function. Put on some places to maybe avoid so we don't get triggered, so that they're able to function in their daily life. And then when they come back to therapy, we explore again, and then again going back and forth between therapy and life, and putting up some avoidances as well can be helpful. And then he talks about adjusting to the new environment without the person there. And this part can be very challenging for a lot of people, adapting to this new space, this new environment with their loved one not there, with their maybe support system not being there. And here we explore both the internal and the external experiences of the person. So how are they feeling on the inside, their grief? And also how is it impacting their environment as well? And the last one he talks about is the letter R, reinvest in the new reality. And so many times when someone experiences a loss, they feel that a part of them is gone. And many times they start to focus on that part of them that's no longer here. And so in this space, what we do is we help them to focus on the things that are here. So for example, memories. Sometimes our clients might think of, man, I miss this person. They used to do this. They used to say this. We used to go here, do these things. And then what we do as a clinician or as a supporter, we then have them focus on the new reality. Well, what are some things that you did learn from them? What are some things that you learned from their life, that you gathered from the life that's made you who you are today? And so it brings them to the present moment. I'm finding those positive things that happen, those joys and those strengths that they received from their loved one. Another example is passions. That's how a lot of nonprofit organizations are founded. Drug driving initiatives, that's how a lot of them are founded. Moms lost their sons or their daughters to drug driving, and they started a nonprofit organization. I'm sure within your community, you think of nonprofit organizations. If you go to the story of the founder, you'll see at some point they experienced a loss, most likely. And so sometimes it's about helping our clients find passion within their loss. Hospital wards. A lot of hospital wards are named after people who have died. And so the loved ones want the people who are living want their loved ones to live on. And so they found passion and they donated. So there's just some examples of reinvesting in the new reality, them finding some type of peace and joy in the present moment because they have known this person, or finding a purpose because they have known this person. And so kind of the overall view, it's about seeing our clients' loss, their present, where they are right now, and their future as well. The next one is the 6 Needs of Mourning. This particular one is also by Dr. Alan Wolfelt. And so this particular one, he talks about acknowledging the reality of the death, embracing the pain of the loss, remember the person who died. I mean, we're going to talk about different ways to help our clients stay connected to the people who have died, and then develop a new self-identity, creating their new environment. And then searching for meaning. Searching for meaning can be very helpful for a lot of clients. And that can be related to meaning as far as their purpose, how they're going to function moving forward. And then that's also a component where we can embrace culture as well. What is your culture? What is your spiritual orientation? Share about this loss. And the last one he says is receive ongoing support from others. And again, we're going to talk more about support systems and the importance of support systems and how beneficial they can be in the grieving process. The next one is narrative therapy. So we're going to spend quite a bit of time talking about narrative therapy because there's some constructs in here that I've noticed can be challenging to embrace and to recognize. And so we're going to really dive deep into the narrative process here in just a minute. But before we do that, we're going to talk about retelling, this concept of retelling the narrative. And so when it comes to narrative therapy, it's about helping our clients move and organize the micro narratives of everyday life into the grand scheme of things, the macro narrative. And it helps them to better understand themselves and understand what their environment as well. And also understand the distinct emotions and the range of emotions that they may be experiencing. And so when it comes to retelling their narrative, it usually happens towards the beginning of session. So you should come into session, you kind of do a check-in, and then for 10 to 15 minutes, they retell their story. So during this part, it's not necessarily about just telling their story, just to tell their story. It's more about retelling their story to be able to look at new spaces that we may not have recognized before. So new opportunities to go in different directions or new chapters that we could possibly start. And again, during this time, it's about helping our clients to regulate their emotions. So if our client's telling the story and we see them becoming physically agitated, their legs are shaking or they're crying a lot, we can pause and say, let's do a check-in with ourselves. Let's do a scaling question. We ask them a scaling question. Let's do a coping skill if we need to. And we help them to learn how to regulate their emotion, how to manage that emotion, that intense emotion that's happening. When it gets to a healthy place, then we go ahead and go back to the story. And so what this does, it helps teach them outside of session, they're going to have these memories, they're going to have triggers, they're going to have these intrusive thoughts. So what this does, doing it in session, it helps them outside of session to be able to remember, oh, wait, I can control this intense emotion. Let me pause for a moment. Let me do my coping skill, whether it's deep breathing. We're going to go over different grounding techniques that we can do with our clients. But let me do my grounding technique. And then let me go ahead and go about my day and do what I need to do. So doing it in session can be very helpful in them increasing the likelihood of doing it outside of session. And so again, it goes back to that revisiting the story and then coming to the present moment, revisiting present moment, just this back and forth during the retelling narrative. And so kind of breaking down this concept of narrative processing, again, it's not about retelling the story. It's about helping them to process it. And so when it comes to narrative processing, the external narrative, that's related to the objective or the facts of the story. The internal is that what it sounds like internal experience, those emotion-focused story. And reflexive is the meaning-oriented story, the interpretation. This is where culture and belief systems can come into play. And then foster narrative is what we're doing as clinicians. We are helping our client move between all three of these. So let's break this down a little bit more. So let's say a client comes in, a parent of two, or a parent, and they have a newborn child. And let's say when the child was born, unfortunately, it was a stillbirth. And so external narrative would be having the mom or the dad describe what happened. We went to the hospital. That's a fact. We saw the doctor. That's a fact. We had the baby. That's a fact. The baby was born stillbirth. That's a fact. Those are all facts. And then we have them in between there, ask them, well, how did that make you feel going to the hospital? Oh, I felt panicked. I felt rushed. I felt anxious. How did it feel when the baby was born, but you didn't hear anything? I was scared. I was panicked. And having them acknowledge their internal experience, those emotions. And then the reflective is more towards the end. Once we've worked through the internal and the external, asking them, well, what does that mean for you? Kind of looking back and your anxiety through the roof, what does that mean for you? And maybe they might explore, well, I knew something was wrong. And maybe it was just my instincts telling me that something was wrong. So helping them explore that. When you didn't hear any noise and you saw the doctor's face, what did that mean for you? Well, it meant that something was wrong, and I knew something was wrong when I first got to the hospital. So just helping them explore their story. And again, foster narrative is what we just did, going between all three of the stories. And so here I'm going to pause for a second as well and talk a little bit about culture and racism. Because many times our clients will come in maybe from a different culture, or a different race than us. And they might be experiencing grief because of something they experienced within their culture or within the dynamics of interacting with people. And we can definitely use narrative to give them support. So let's say, for example, an African-American woman, she decides, you know what, I'm having these physical ailments and I want to go to the doctor and get help and get support. And she goes to multiple doctors and each of them share with her, well, we can't figure out what's going on. We can't figure out what's going on. And some of them even mentioned, you know, maybe it's kind of in your head. There's nothing's really going on. And she says, you know what, I'll finally go to this one specialist and just try it and see what happens. So she goes to the specialist and the specialist shares that, you know what, we can't find anything wrong. Sorry. And on their way leaving out, they make a racial slur. And so now the individual, the African-American female, she is feeling angry and upset and unheard. And she then begins to experience grief, so much so that when she goes to work, she begins to lose confidence. She doesn't speak up as more. She has lack of motivation to do anything anymore. And so what has happened? When we go through therapy, when we explore her story a little bit more, we realize that she had this anticipated trajectory of how her life was going to look. She thought that I was going to go to the doctor and I was going to find a result. And that's not what happened. Instead, she did not receive a result. And it caused her to then experience a loss of a trajectory, a loss of an anticipation of what was going to happen. And then when she experiences this loss, it then caused her to feel grief, to experience grief. So that's an example of how racism can play a role in an individual experiencing grief. And so going back to that initial example of the parents who lost their child, they have this anticipated trajectory of this is what life is going to look like. I'm going to, our child's going to go to this school and they're going to play this musical instrument. We're going to name our child this name. They're going to have these children as playmates. They're going to go to my alumni. They're going to be an alumni and go to the college that I went to. And then they have a stillborn birth. And then all of a sudden, all these anticipated trajectories that they're aware of come to the forefront of their mind. But there's two types of anticipated trajectories. There's the spoken and the unspoken. So the spoken ones are the ones I just mentioned. They're going to go to this school. They're going to have these playmates. They're going to go to my college that I graduated from. And then the unspoken ones are things they didn't even realize that they were expecting to happen. Maybe they thought that, maybe the dad realizes, oh man, I'm not going to be able to teach my son how to shave. Man, I'm not going to be able to teach my son about the stock market. Or maybe the mom says, wow, I'm not going to be able to teach my son how to date. I'm not going to be able to get my son dressed up for prom. You know, so these realizations start to come to the forefront. These things that they thought was going to happen, they're realizing are not going to happen. This particular trajectory, this line of thinking, this expectation that I had is not going to happen. These assumptions that I've created aren't going to happen. So it's an abrupt cutoff of their reality. And so what we're doing is we're helping our clients, again, going back to the narrative processing, we're helping our clients to explore that external, what they thought was going to happen. How did that make you feel thinking about them playing with this playmate? How did it make you feel thinking about them going to the college you graduated from? And helping them explore those thoughts and the emotions that they had about it. And then bring them to reality. Well, what is it actually like now, seeing that your son is not going to go to the same college as you? You're not going to be able to teach him how to shave. You're not going to be able to help him get dressed for prom. You're not going to have these experiences, and helping them go through that. And again, the external, internal reflexive, just going through that whole entire process as well. And then the last part is the new trajectory. Well, how do you want life to look? And of course, this is happening across multiple sessions. This is not just one meeting and that's it. This is multiple sessions. Well, what does that look like for your future? How do you want your future to look? And so that's how we can use the external, internal, and reflexive when it comes to a parent who's lost a child. That's just an example. And so going back to the racial incident that happened just a moment ago, same thing. The person, this is what I expected to happen. I expected to get a diagnosis. I expected to be treated the way everyone else is treated. But that's not what happened. So there's an abrupt disconnect in their anticipated trajectory. So now we sit with them, well, what really did happen? Well, what really happened is I went to this doctor and this is what happened. This is how I felt. These are the thoughts that I had. This is the meaning that I'm gathering from this. I now see myself as an individual who maybe not as worthy as others. Maybe I'm not as important. My confidence has decreased. Maybe my identity has been shaken. And then we help them to figure out what is a new trajectory. How do you want to move forward from here? And so I give that specific example, not because just it's an example of racism, but it's actually reality. It's true. It's real. There's a American Journal of Medicine. They did a research from the Duke University Medical Center and the University of California in San Diego and Georgetown University. And they realized that they did an assessment. They had a Caucasian male and an African-American female. They shared the exact same symptoms with the students there. And the research shared that the students reported that the male's health was significantly higher compared to the female's health. Now, mind you, they shared the exact same symptoms. And then when it came to diagnosing, the students were less willing to provide a diagnosis for the African-American woman compared to the male Caucasian. So that's just an example. There's another study that was done as well regarding treatment with regarding pain amongst minorities. It was done in 2012. And so they did analysis over 20 years. And what they did was they found out that a lot of the African-American patients reported pain. They were 22% less likely than Caucasian patients to receive medications from doctors. And it's not just African-Americans. There's definitely other cultures as well. In the health service research, they shared a study they did in 2017 that 1 in 5 Native Americans reported that they had experienced discrimination in clinical encounterments. And 15% reported avoiding seeking healthcare services because of discrimination. And so some of the stories that our clients share with us about experiencing discrimination and racism, it's real. And so narrative therapy is a great approach to help them navigate and work through that grieving process. That anticipation of being treated fairly, being treated equally, being treated non-judgmentally, and then having them not being treated that way. Their anticipated trajectory being destroyed and taken and stripped away from them. So experiencing that loss of being treated equally, that loss of identity for some, loss of medical services for some as well. And then when it comes to narrative therapy, we as a therapist, we aren't just sitting and listening, of course. We are definitely doing a lot of active listening. We're taking note of themes. And so our goal is, once we take note of these themes, is we encourage our clients to explore some of these themes, whether they're unhealthy themes that are reoccurring or some healthy themes that are bringing them more strength or more motivation to continue on in their healing journey. And we're also looking for different streams as well. Kind of going back to what I had mentioned as far as a lot of nonprofit organizations being founded after a loss. So maybe we have a client coming in and they're working through the grieving process. We're doing narrative therapy with them. And we hear just a smidge of passion in a direction. So what we as therapists do, we take note of that and we continue on doing the narrative process with them. And maybe 8-9 sessions down the road, because we took note of that passion, we might revisit that passion and say, I remember you had talked about this particular passion. Let's explore that a little bit more. And many times that passion can help them create their new anticipated trajectory after experiencing that loss. And so again, in narrative therapy, our goal is not to solve our client's problem, is not to solve any of their problems. It's more about seeing grief as an experience. Grief is something that is not it's not a pathology. It is something that we experience because of loss. It's natural. And so it's more about helping our clients to explore the loss, explore their grief, and help them to figure out, how do you want to move forward from this grief? How do you want your next chapter to look, your anticipated trajectory to look as well? Right, so the next one I want to talk about is CBT. And so CBT is cognitive behavioral therapy. It is very focused on concrete tools that can be utilized. And again, we're going to have some concrete tools that we're going to talk about here in a little bit. But one of the concepts is a cognitive triangle. So basically the thought process is that we have our thoughts at the top, our behaviors and our feelings. And there's no particular order on the triangle this is placed on. But the concept is that our thoughts and our behaviors and feelings are all impacting each other. And so if we change how we think about something, we can then change our behaviors and then change our feelings. If we change our behaviors, we can then change our feelings and our thoughts about something. So it's all touching and all can be impacting of each other. So let's say, for example, an individual, they are feeling guilty about not having a healthy relationship with their mom who's died. And so they have a lot of guilt. And because of the guilt, the feeling of guilt, because of the thoughts of, man, I really wish I said I loved you. I really wish I said I love you. Those thoughts, I'm a bad person. I don't deserve to be here anymore. Their actions could be self-harming. So maybe they might engage in substance abuse, or they might engage in self-harming behaviors. And so one thing that we can do is help them to change the thought. So what's another way we can look at this? So come to find out, after talking with the person, you might find out that they actually had a good relationship. But it was the last conversation they had with their loved one wasn't a healthy one. So then we help our clients to focus on, well, actually, I am a good person. Actually, I did do a lot of loving things towards my mom. Actually, I did give her a lot of care when she needed care. I did give her a lot of support. And so it's about helping our clients to change their thoughts, and then their feelings become more empathetic towards themselves, more loving, and it reduces their behavior of substance abuse or physical ailment or physical harm as well. So it's just an example of how cognitive triangle can be helpful for some clients. And the next one is concrete coping skills. Again, we're going to talk more about some concrete coping skills here in a bit. And usually when we're doing CBT, there is a lot of homework that's giving, because again, the homework is more about replacing those maladaptive behaviors for positive and healthy behaviors and healthy thought patterns as well. Okay, and so now we're going to watch a small clip about the dual process model. This particular model, it came out in I believe it was the 90s. Yeah, the mid 90s. And so this particular one, we're going to actually watch it. Dr. Robert Neymeyer, for those who are familiar with the grief community, at some point you've heard his name before, but he's going to talk a little bit about the dual process model. And yeah, let's go ahead and dive into the video. And I do want to let you guys know that while we're playing the video, there is going to be a small part where the video will go blank, but you will still hear his voice.
In the context of our everyday life experience, as people who are negotiating hard transitions, unwelcome changes of many kinds, not only to a loved one or of a loved one to death, but many forms of life-changing loss. We orient to the loss when we do what Sigmund Freud called Trauerarbeit, the work of grieving, focusing on the character of the loss, the associated emotions, as we try to, in some way, manage the intrusions or waves of grief that will sometimes wash over us, like sometimes a storm surge associated with Hurricane Irma. We may be at risk of being devastated or carried away by it. We're attempting then to engage in a kind of emotion regulation at one level, while at another level, we're struggling to relocate the deceased in our lives now. Where is this person, right? Where is this maybe position, this place that once defined an important kind of anchor of meaning in my life? As I stare now from the edge of the world that I'm now in into the devastation of the world that was, how do I somehow accommodate those changing realities? And as we attempt to do this, we tend to deny and push away from the call of the world. We don't want to hear that call. We draw down into our grief. We seek out the kind of trusted connections with others who we believe can hear what others will not. And so in the privacy of our own hearts, in the privacy of trusted relationships, we attempt to process the loss itself. But that's only part of the picture, because at other times, the world will grab us by the collar and pull us over into necessary restoration. We have to, in some way, re-engage life. Our children still need to eat. We still need to be able to get some sleep. We have to step back out into a world that needs us and that we need, even if we carry into that world an unspeakable degree of heaviness, sadness, anxiety, and hopelessness. And as we step into that world, we step toward what they call the restoration orientation, the attempt to put together a world that works again from the fragments of the old. It is a process of rebuilding. And sometimes we have to replace foundation stones in that world in order to again have a secure base on which to stand. As we do this, we do new things. We try out new roles. We reformulate our roles and goals in light of the loss that we have suffered, right? Life cannot be the same. We have to find a new normal. And as we do this, we necessarily deny and avoid the call of our grief. So denial and avoidance of both the grief and of necessary changes are an inherent part of grieving. They are not pathological. They are just part of the path. And as suggested by the red line arrow, the core feature of this process is an oscillation, a kind of pendulum swing, back and forth between these two orientations, where gradually we may spend, if our adaptation goes well, relatively more time in restoration and less time absorbed in the grief. But the grief will always remain available to us as a kind of room where we knock on the door and can re-enter that space of grieving, or one where we hear the knock and call of grief sometimes when we least expect it. This is a model that I think is quite helpful for dealing with transitions of many kinds. It acknowledges that both orienting to the loss and orienting toward restoration are a normal and healthy aspect of grieving. Time needs to be made for both of these things. And the overall movement through these dual processes of coping with bereavement is one that gives us greater and greater choice about how and when we engage each of these. So we are not just unconsciously pulled into the grief when we are not expecting it. Indeed, we might invite that. We might make an appointment, in some sense, with our grief. At other times, we give ourselves permission to not orient to the grief and to reorient to a changed world.
Right. And so I want to check in with you guys and see your thoughts. Just for a moment, I want you to think about your thoughts as far as what he shared, what this idea of loss-oriented and restoration-oriented, and kind of the benefits of it, of giving our clients this psychoeducation on these options that they have available, and letting them know that they have an option to sit in the loss-oriented or sit in the restoration-oriented. Thinking about maybe an individual who is at work and they're in the middle of a presentation, and they're sitting in a boardroom and they are getting pulled into the loss-oriented, saying, you know what, I see you, I acknowledge you, I'm going to make an appointment with you later. I'm going to stay here in this present moment right now. So that brings a lot of empowerment to our clients. Recognize that they can say, I see you, I accept you. I'm going to come back to you in a little bit. Now, the key is that they do go back to the loss-oriented. And so even in those moments of loss-oriented, saying, yes, I've been with you for a little bit. I have mourned, I have cried, but now it's time for me to go back into restoration. It's time for me to go back into the world and, like he said, feed my children, go to work, do the things I need to do in daily life. And so helping our clients realize that there's this back and forth that they can go to between can be very empowering to them. Yeah, so I definitely encourage you guys to share this with your clients. The next one to talk about is a TEND model. And so the TEND model, there's been quite a bit of research done on this particular model. And as you go through it, you'll hear a lot of mindfulness discussion. And so some of the research is here. In 2009, Turner did an assessment or a research study on it. And they share that a lifestyle of living in mindfulness to better support our clients and promotes our own self-care. Mindfulness practice by clinicians leads to a greater empathy, compassion, and attunement, all of which can help strengthen rapport in the therapeutic relationship. And that's the ultimate goal. As we as therapists, we as giving people who are giving support to those who are grieving, is to improve our relationship with our clients and to make sure we don't get burnt out. So self-care is very important as well. The next one was done in 2007 that, for example, a randomized controlled trial showed that clinicians who meditation practice alone improved the outcomes for clients. Another study done in 2014 showed that low levels of burnout and compassion fatigue and high levels of compassion satisfaction amongst clinicians and volunteers trained in a TEND model. So definitely has a lot of research sharing the benefits of it. And so let's go ahead and dive into it. So when it comes to TEND, it's basically the word is broken down. Before we do that, let's go ahead and do this quote real quick. And it says, and when we allow ourselves to feel that which is legitimately ours to feel, we rebel against the rigid grief-denying structure of society. And so I thought that was very beneficial for this particular model. And so as we're going through it, you might hear why this might be beneficial. And so the first word is attunement. So attunement is more about the clinician. We as a clinician being embracing mindfulness. So in other words, it's not just about the therapeutic relationship, we're actually taking it outside of the therapeutic walls. So we are embracing mindfulness in our lifestyle. And by us embracing it in our lifestyle, we are, when we come to the therapeutic relationship, we are then more able to embrace self-care a lot more and to support our clients, as well as it's shared in that study just a moment ago. The next one is trust. So trust is kind of what it sounds like, just building a connection. So which means it's a non-judgmental environment. It's where interpersonal communication skills are embraced. And it's where the client feels that they can be themselves with no judgment at all. The next one is the therapeutic touch. So this particular one, I definitely want to encourage you to be mindful of who you are as an individual. Some clinicians are okay with therapeutic touch, some are not. It's to each their own. And so when it comes to therapeutic touch, the concept behind it is that it's encouraged to, of course, be mindful, but also to be mindful not only of how it's impacting you as an individual, but also how it's impacting our clients. What is the purpose of this touch? Is this because I'm feeling comfortable, because I want to comfort, or is it because my client actually needs comfort in this present moment? And then it does go on to share the importance of knowing our clients, building trust first, and then knowing our clients and their perception of touch. Kind of being mindful of clients who maybe have a history of sexual abuse, kind of being mindful of maybe touch may not be something they're comfortable with. So definitely being mindful, again, of our clients and who they are as an individual and our own stance on it as well. I know some clinicians say, I'll only give a hug if it's the last session and it's like a hug goodbye and that's it. And others I've seen and heard them share in their therapeutic relationship that sometimes when their clients are crying, they might touch their client's hand to bring comfort. So again, it's about you as a clinician, your comfort level, and also being mindful of our clients as well. The next one is egalitarianism. And so that is basically an awareness that is brought to the natural power differentiation within the therapeutic relationship. So the goal here is to try to create some equilibrium in here. And so a way we can do that is psychoeducation. The information that I'm giving you guys today, give to your clients. If you see that your client is experiencing cumulative grief, let them know this is what you're experiencing right now. This is what it looks like you might be experiencing. If you know that your client witnessed somebody getting killed in front of them, letting them know you might be experiencing traumatic grief right now. And at some point it might turn to PTSD. Let's work on some things to hopefully not go in that direction. And so a lot of it is about, again, psychoeducation, providing that information. And it's different ways. Sometimes it's simply talking, the way we're doing now. Other times it could be through books. I know a lot of my clients like biographies. So sometimes providing biographical information to them. Sometimes people like to read magazines, so giving them magazines, giving them the resources that resonates with them, and then letting them learn about what they're experiencing. It can be very empowering to them as well. Another thing to keep in mind in this particular place is being humble, not coming in as if we are the expert. Yes, they're coming to us because we've had training, but at the same time, each person is uniquely themselves. And so it's about letting them be the expert on who they are, on their thoughts, on their feelings, on their spiritual orientation, on their culture, and just sitting with them and letting them be the experts. So it's about us coming to this interaction and this therapeutic relationship in a very humble and manner. Another one, the next one is nuance. And so this requires us as clinicians to be mindful and attentive to our client as an individual, treating them uniquely based on how uniquely they are. And so that's when we maybe explore their culture, their spiritual orientation. And again, it's different for every client, going back to what we talked about earlier in spirituality, how a client can come in and say, yes, I'm a Christian, but that doesn't necessarily mean that they believe everything that a Christian believes. So it's about meeting our clients. Well, tell me, what does that mean for you? Tell me, what does that mean for you to say that I come from a Buddhist background? What does that look like for you? Again, meeting our clients where they are. And the last one is death education, kind of what it sounds like, providing psychoeducation, again, through books and articles. A lot of movies are coming out now related to emotions and feelings and death. So even maybe looking into some movies, especially if you work with children, there's quite a few coming out, animations coming out related to that. And so as you can see here, the 10 model, the goal is not to quote unquote fix grief. It really is about sitting with our clients and helping them to increase their emotional tolerance. It's about helping our clients to know that they are in a safe space. They're in a space where they are accepted, and whatever they're going through, we'll be going through together, a journey together. And so some of the techniques that are utilized in the 10 model is journaling. And there are different types of journaling. We're going to talk about the different types of journaling here in a little bit, but journaling exercises are many times done either during the session or after the session for homework. A lot of the exercises as well are breath work, and we'll talk about breath work here in a bit as well. But there's a lot of breath work, some deep breathing, different types of meditations are embraced as well. And quite a bit of it is about also being one with nature as well. So I'm intentionally going out into nature and finding metaphors in nature. So for example, maybe somebody sees a cactus and a flower. So they may say, grief is like a cactus. It's prickly at some points, but other points it can be beautiful. It can be beautiful to think about the relationship that I had with this person. It can be beautiful to think about how much this person has impacted my life to be where I am today. So it's about helping our clients finding metaphors as well in their grieving process. Right, and of course there are some limitations. And so some of the limitations include these particular ones that I've listed here. So we're gonna go just through a couple of them. The first one is individual grief counseling isn't always inclusive. There's other forms of support, including online supports. That's become very popular. There's podcasts where people find that psychoeducation that they might be looking for. There's also group counseling. There's community supports. There's memorial events as well. There's ritual activities, and again, psychoeducational workshops. And then the last one is the last one at the bottom. It says most longitudinal studies of bereavement show naturally occurring declines in bereavement symptoms with the help of family and friends. Apparently, most mourners are able to work through and integrate their losses relatively well. And so that goes to share with us that just because someone has experienced a loss doesn't mean that they're going to get stuck in the grieving process. It doesn't mean they're going to need therapy. It doesn't mean they need to go to a group. Sometimes it's just a matter of them having a healthy support system. And we're going to talk about creating a support system here in a bit. But sometimes that's just about having a healthy support system. There's been quite a few studies done when it comes to cancer patients, more specifically women who have experienced breast cancer. And a lot of the studies show that whenever an individual who experiences breast cancer during her recovery period, if she is involved in a support group of some sort, she's more likely to heal a lot quicker compared to an individual who does not join a support group. And so it just goes to show how much our support system really plays a huge role in our grieving process. And so at this time, I'm going to check in to see if there's any questions. I know we're going to talk quite a bit about interventions here in a moment, but before we talk about interventions, I do want to pause for a moment to see if there are any questions. And so I'm going to stop the share just for a moment. Or actually, can you let me know if there are any questions to let me know if I need to stop the share?
I have not seen any come in the chat, so unless someone has something did pop in. Someone said in the chat they would like to hear more about how you structure your grief groups.
Yes. Oh, wonderful. Yes. Actually, we're going to talk more about that when we get to interventions. We're going to talk about some different strategies and techniques that we can utilize as well. And there's actually a book I'm going to refer to you guys that's can be very helpful on how to actually structure and the different things you can do in each of the sessions as well. Yeah, great question. Yeah. And so if there aren't any other questions, we'll go ahead and go on to ethics and professional boundaries. This is very, very important for us to keep in mind. I know based on kind of what you guys shared with me of who's all here, we all have different responsibilities, it sounds like, based on our licensing board. And so it's important that you're aware of your licensing board and requirements, making sure that we stay in alignment with that. And so that's what we're going to talk about just a little bit here for a moment. And so vulnerability, it's a key thing that a lot of people may not realize, but when someone is grieving and they come to session, they come to an interaction with us, whether it's in their home, at school, in a grief group, or in an actual therapeutic environment, they're being vulnerable. They are letting you inside of their life. They're letting you inside of their emotions and their in most deep thoughts that they haven't shared with anybody else. And so it's important for us to remember not to do harm when someone is coming in to meet with us, and to consistently engage in professional behavior at all times. And the next one is culture and spirituality. Again, we talked quite a bit about this earlier, but it is important for us to be mindful of a client's culture. So for example, let's say it's in our client's culture to see a therapist as a teacher and to give our therapist respect the way we do a teacher. And so maybe they might try to come to sessions with gifts because they see you as a teacher, they see you as a leader to them. So how do we handle those conversations? Or maybe they, this one has come up quite a bit with several people that I've used to do supervision with, was being invited to the funeral. How do you handle that? It's a part of their culture to have their spiritual leader or their mental health leader or their teacher to come to their funeral, to come to their space where their loved one has died. So the question comes, do we attend? And so that's where we ask more questions. Well, what would it look like if I were to attend? How would you want to introduce me if I were to attend? How do we maintain confidentiality if I were to attend? And then also exploring you as a therapist. How comfortable would you be with moving the therapeutic relationship outside of the four walls? And then also asking, well, what does this mean for our clients? What is your role there? Is your role to help them not have a panic attack? Or is your role simply to be a support? Or is maybe some dependence developing? It's maybe some unhealthy dependence developing. So it's about exploring and asking these questions with our clients to see if going to the funeral really is going to be therapeutic or not therapeutic as well. Another thing to keep in mind is confidentiality. Going back to, let's say you're doing couples work and one of the partners dies and the other partner says, I would really like you to come to the funeral. Having that conversation, well, if I go to the funeral, how do you want me to be introduced? Because maybe he or she wants to keep it confidential that they were going to couples therapy. So navigating that situation with them. And then the next one is intervening in a crisis. Making sure that we are, again, engaging consistently in professional behavior as well. And then death competence. Attending trainings like this, great start. And definitely embracing other organizations as well, other opportunities to continue further educating yourself. So through books, again, I have the resource page that has organizations, that has online articles, books that they promote to help learn more about grief. And so I definitely want to encourage you guys to take a look at that once you guys do get the PowerPoint, to look at the resource page for books as well. And then of course, vicarious grief, being mindful of us listening and hearing grief over and over and over, and hearing people's loss, that can impact us if we aren't careful. If we aren't careful, we can actually take it with us into our lives, and it can impact relationships that we have with other people. And so it's very important that we have our own coping skills and our own strategies to be able to leave work at work. I remember when I was in undergrad, we had to, in grad school, we had to interview mental health therapists. And we had to ask them certain questions. And one of the questions that I asked them was, how do you leave work at work? And one of the clinicians that I had interviewed at the time, she said, the second I walk through that door, whatever I heard stays there. And that's always resonated with me. So I encourage you guys to find something that helps you to leave work at work, so you're able to interact and function and be with family and friends, fully present with them. And so sometimes with traveling, a lot of people would do that on their way home from work. They would process and they would kind of let go of some of the things that they heard in session and process and make peace with the things that they heard in session. So when they walk through the door of their home, they can be fully present with their family. But with COVID-19 happening, a lot of people, they were at home doing therapy. So they didn't really have that opportunity to that transition period. And so I've had several clients, I said, hey, how about you hop in the car and act like you're coming from work? And it worked for them. And so sometimes we as therapists, we have to think outside the box and do those same things. Maybe going for a drive to clear our mind if you are still working from home, or finding other things that you can do to help clear your mind after hearing some of these experiences. And then of course, many times it is recommended that we as therapists, we as clinicians, we as supporters have our own therapists as well. So we can process those griefs, those losses that we hear about, those images that we may see because of what our clients have shared. It's very important that we have our own clinician as well, so we can always connect with them as needed. All right, so now we're gonna play a little game, have another quiz, see how well you guys do. And so this is regarding ethics as well. And so I'm gonna see if I can pull up the chat. And so we're gonna start with number one. So number one, blank is using knowledge, skills, abilities, and judgment to help clients while respecting their decisions and protecting them from harm. Which one do you think that is? Non-maleficence, fidelity, C, autonomy, D, justice, or F, beneficence? What do you think that is? Using our knowledge, skills, abilities, and judgment to help clients while respecting their decisions and protecting them from harm. The key here is protecting them from harm. Protecting them from harm. What do you guys think that is? A, B, C, D, or F? All right, I'm seeing some A's. Okay, yes, you're correct. A. Yes, protecting them from harm was the key. Yes, non-maleficence. Number 2, preserving and protecting the rights of the client to make his or her own choices. The key here is making his or her own choices. C's, I'm seeing a lot of C's. Yes, you're correct. Autonomy. Autonomy, giving them the ability to make their own choices. Number 3, providing fair and equality in the distribution of services. D, nice. You guys are great. All right, D, you're correct. Justice. Number 4, contributing to the welfare of the client. Contributing to the welfare of the client. F, yes, you're correct. Beneficence, F. And the last one, there's only one left, building trust by being loyal, faithful, and honoring commitments. What would that be? Letter B, fidelity, yes. And so I know every state is different. Some states do require us to do ethics consistently. Some don't. I definitely want to encourage you, if you are in the state that does not require you to do ethics training every year to renew your license, to please keep up to date with them. Because it's very important that we are mindful of our requirements and what's expected of us as well. And so we're going to do a case study. Yes, case study. So we're going to do a case study, and we're going to actually apply some of the ethics that we just talked about, some of the models that we just talked about, the different types of grief we just talked about as well. And so this is Mary and her family. This is a patient I had, goodness, maybe two and a half years ago. I had this patient. And of course, the names have been changed, and other factors, identifying factors have been changed as well. So Mary is a 54-year-old Caucasian female who's been retired for 4 years. She's been attending therapy to work on improving her relationship with her daughter. During intake, Mary reports that her daughter hung up on her and texted Mary that she was quote unquote gaslighting and didn't want to talk to Mary anymore. Mary has been married for 35 years and has a 28-year-old daughter who is also married. Mary and her husband have 3 houses, one of which they rent out to tenants. She also reported wanting to work on, quote unquote, making my brother and sisters help my mom. At the time of intake, Mary had one remaining parent who was 86 years old and having health concerns, including dementia. She reports having 3 older siblings and 1 younger brother. All of Mary's siblings live in the same state as Mary's mom, and 2 in the same city as Mary's mom. Mary drives 45 minutes 2 to 3 times a week to visit her mom. She reports that she's the only person who ever visits her. Mary reports growing up witnessing her dad's anger and experiencing her mom's demanding expectations. Throughout therapy, Mary has acknowledged that her parents were toxic, and each of her siblings' verbal altercations, and having verbal altercation with each of her siblings, including herself, as being unhealthy. She reports a history of her and her siblings threatening each other, but never following through on the threats. Mary was initially consistent with therapy services. About 2 months into therapy, Mary was questioned about how she contributes to conflict between her and her daughter, and her siblings. She soon began missing sessions and stopped coming to therapy. 2 months after Mary's last session, she returned to therapy reporting that her mother died due to health concerns. Mary appears to be doing well using coping skills to manage her grief. After working consistently together for 3 months, she learns that her mother's will, and that she learned that in her mother's will, everything was left to Mary, including 2 houses, a boat, and a large sum of money. Mary decided to sell one of the houses and rent out the other home. She shares with you that she didn't want to include her siblings in the decision because, quote unquote, they never helped with mom, and that legally Mary could do whatever, quote unquote, do whatever I want. When asked how she's doing with managing her grief, Mary shares that she has, quote unquote, so much to do that I can't think about my mom not being here. Mary informed her siblings of her decision and encouraged them to go to the house by a certain date to gather the items they'd like to keep. One of her 4 siblings went to the home and took diverse items. The last day of her siblings to go to the house passed. A few days after Mary's deadline, her other 3 siblings asked to come to the home to gather items. Mary agreed, but they never showed. Mary reports being very angry and felt that her time was disrespected. Mary moved forward with moving the items, selling the house, and renting out the home. During the process, her three siblings, especially her youngest brother, said mean and hurtful things towards Mary. Mary admitted that she responded to their verbal attacks with insults. Last week, Mary and her daughter went to the rental property to get the home ready for renters. Mary's younger brother, who lived in the local area, threatened to damage Mary's daughter's car. Mary and her daughter quickly leave the home in fear. All right, so let's go ahead and dive into this. So what are some maybe types of grief that you might hear in this experience? What are some types of grief that you think Mary might be experiencing right now? Okay, someone's saying traumatic grief. Okay, so possibly traumatic grief in how the mom died, absent grief, not having a reaction to it yet. Yeah, disenfranchised grief, possibly, because she has an overload of other things going on. All right. Yeah, great. Thank you guys. Yeah. Inhibited grief, trying to focus on other things. Delayed grief. Yeah. And so thinking about supporting her, kind of what are your thoughts about where to support her? Would it be maybe the brother, checking in on the brother to see about the brother's threat to harm the vehicle? Or would it be focusing on why she initially came in, to connect more with her daughter? Or maybe it would be to see about her working through her grief for mom. In this particular session, I asked her, well, where would you like to start? And she said she wanted to focus mainly on her siblings and the anger and frustration she had towards them for kind of putting her in this situation. And then she also had some anger towards her mom for putting her in this situation as well. She wished her mom had told her what to do with the property versus putting it all in her hands. And now she had to make all the decisions. And so thinking back to us as clinicians, we're human beings. Maybe there's some triggers or maybe some biases, potential biases that may have popped up for you. So what are some maybe potential biases or some triggers that may have happened for you? So for people who may grow up in a family where gaslighting is happening, and then to have a client come in saying that they're being accused of gaslighting, and we're seeing it in session, them gaslighting, that could be definitely triggering. Somebody saying brother's attacking. Yeah. And my first instinct was to go towards the brother. Let's talk about the brother. Let's talk about safety. And we did towards the end of the session talk a little bit about safety. And that was something that she wasn't concerned about because it was a pattern for her family to do that, to give threats, but to not follow through. But I still wanted to check just to make sure. And thankfully the brother never did do anything in that situation. But yeah, that can definitely be triggering. Hearing a family member threatening another family member, that can definitely be triggering as well. So it's important for us as clinicians to be mindful of when we're sitting in session and we're hearing our client's story, we're in our client's home and we see something or we hear something that's triggering. It's very important that we're aware of how it's impacting us in those moments and to be able to do something that helps ground us and bring us to the present moment, the here, the now. And then after session, being able to process that experience, being able to express maybe some sadness or frustration or confusion that we had initially felt there in session. So it's very, very important to be mindful of ourselves. What about some ethical constructs? What are some ethical constructs did you see in this particular case study? Autonomy would be one, letting her make her own decisions. We may be tempted to guide our clients on, well, this is how you should handle your family interaction, or this is how you should handle the things your mom left you, or this is how you should handle this or handle that. But giving our clients autonomy to make their own decisions. Yeah. And then what about justice? Kind of thinking about our clients and someone else said justice. Yeah. So think about our clients And how are we treating our client? Are we treating our client differently because of their socioeconomic status? Are we treating our client differently because of their history of gaslighting? Are we treating our client differently because maybe it is triggering some of the things that they're talking about? So we might avoid giving them as much support as we would give somebody else. So again, self-awareness is very important when we're working with our clients. All right, and I'm going to take a look at time and see how we're doing. We'll see we're doing good on time. So we're going to start on interventions. And then we're going to take a break here in just a moment. So if you guys do have any questions, go ahead and post those questions. But we're going to just quickly start on it and then go from there. So first we're going to talk about acute grief. Going back to the beginning of our training today, we talked about acute grief, integrated grief, and complicated grief, or prolonged grief. And so when it comes to acute grief, remember that's that beginning stage, that beginning period of time. Soon after the loss, emotions are intense. There's a lot of intrusive thoughts many times. There's a deep longing for the person. And sometimes it's hard for the person to engage in daily functions, daily activities. And so this particular section is not necessarily about processing with our clients. It's about helping them regulate their emotion, regulate those intense reactions that they're having after the loss. And so here to the left, we see the SUDS. So SUDS are basically scaling questions, scale of 1 to 10. 1, you're perfectly this way. 10, you are extremely this way. And so, for example, let's say a client comes in, is sharing their story, and we ask them, how do you feel right now talking about this story? And they say, I feel sad. Okay, on a scale of 1 to 10, how sad do you feel? 1, just a little sad. 10, extremely sad, on the verge of crying. And sometimes it's helpful to couple these numbers with an action so that they're able to gauge where they are. And let's say the client says, well, I'm at a 4. Okay, that's considered a healthy number. We can keep going on with the story. But let's say they're at a 7 or above, then that's when we need to pause. Let's pause for a moment and let's go ahead and do a coping skill. And then we do the coping skill, and then we ask them the same question on a scale of 1 to 10, where are we at right now? And we're going to do this, actually go walk through this here in just a moment. But then we ask them the scaling question again on a scale of 1 to 10, where are you? And they say, I am at a 4. But great, we're at a healthy place, good deal. We go on with whatever we're doing in session. But if they say that, you know what, I'm at a 7 still, then that means that coping skill that we didn't work, which means you need to do a different coping skill. So it's about helping our clients find out which coping skills work, and so that way they can use those same coping skills outside of session. And so in order for us to help our clients to understand this concept of regulating our emotions, it's very important for us to first figure out what are their coping skills. And so there's different ways people explain coping skills. So just for a moment, I want you to think about, how do you explain coping skills to your clients? How do you share that information with them? And so everyone does it differently. So I'll share the way I do it, and you can take it, you can leave it, you can edit it, it's up to you. And so I basically say that coping skills are basically things that make us feel better. So let's say, for example, I say things that help you feel better. And there's 2 types. There's healthy and unhealthy coping skills. So let's say someone gets really mad and angry. They pick up a chair and throw it at someone's head. Is that healthy or unhealthy? And most clients have said unhealthy. I have had 2 clients say it was a healthy. We had a whole nother conversation, but it is unhealthy because we're harming another person. I did have one client, I asked for further understanding, help me understand why you think that was healthy. And she described a situation where somebody was trying to attack her, and she threw a chair at the person. She threw an object at the person. So I explained that was more of a crisis situation. So that was different. That was you trying to protect yourself from somebody trying to harm you. So it was a little bit different. And so the other person, they said that they could have done something worse than throwing a chair. So that's what they thought it was healthy. So we definitely had a whole other conversation. But most people will say it's unhealthy to throw a chair at somebody. And then same scenario, let's say we get really mad and angry and we decide to listen to music and go for a walk. Is that healthy or unhealthy? And most people are able to identify that's healthy. And so now what we do is we have them list they're healthy coping skills. These are things that they already do. And so depending on the client and depending on how much time we have in session, so this is also a group activity as well. I know some of you had asked about group activities. So this is something we do as a group, usually during the first meeting, when I first meet with my groups. And so we have a list. And so either we have, sometimes I do 2 lists or 3 lists. So first list are things that work. So these are things, the healthy coping skills that you do that you know already work for you. The second list are things that sometimes work. So for example, music. Sometimes music can help us feel better, but depending on the genre, it can actually make us feel worse. And so I have them create that list. And then the third list are things that they've never tried. And this works really well in groups because once we create our list, we then go around the room and people share what they've written on their list. And so while people are sharing, they might hear something that they never even thought of. So that's when they add it to that third list of things I've never tried or things that I've never tried but would be interested in trying one day. And so once they've listed those healthy things that they already do, we give them lots of praise. Even if they only listed 2 things, we give lots of praise, lots of encouragement, because that can help them be more motivated to try to find more coping skills as well. And sometimes that can be discouraging for them to only see 2. So sometimes they need that encouragement to recognize, hey, you're doing a good job. You have at least 2 coping skills. And so at that point, we then have them to break down this coping skills a little bit more between distracting and expressing. And this is based on the client. We as therapists, we cannot decide if this is expressing or distracting to them because it's different for everybody. So for one of my clients, she said music was expressing to her. When she listened to music, she sang, and when she sang, it helped her to express what she was feeling. So I had other clients say music is distracting to them. So it really is up to the client and how they see it. And some coping skills, it could be both. For example, exercise, it can be both distracting and expressing to some clients. So again, it's about meeting our clients where they are. And then the last component that I do with them is when they're creating their list is I describe different types of people, especially for clients who might be struggling to identify some coping skills. I list different types of people. So I say there's a person who's the intellectual. So let's say the intellectual is feeling sad or overwhelmed or angry or feeling anxious. What they might do is they might read a book, they might do some journaling, they might do a crossword puzzle or Sudoku, they'll listen to a podcast, they'll watch a documentary, they'll do something that is helping stimulate their mind of some sort. And then the second type of person is a physical person. So this is the person, they might take a hot shower, a cold shower, they may go for a walk, they'll exercise. And then the last category is a person who's the creative. So they'll do some woodwork, they'll do needlework, they will cook something because cooking is creating something. They will plant a garden because planting is creating something. They'll paint, they'll draw. And so I help them identify which category they identify with. Most of the time they do identify themselves in 2, maybe all 3, but usually one will stick out to them the most. And so what we do is just help them to be able to create and add more to their list of coping skills. And so that's just an example of what I do with all my clients at the beginning and also in group work as well. And so let's go ahead and dive into acute grief. And again, I definitely encourage you guys to create a way of explaining coping skills to our clients, because it's a term that we hear all the time, but sometimes no one's actually explained to us what it is. And when we say it, everyone might have different interpretations of what coping skills are. So it's great that we're all on the same page at the beginning of our therapeutic relationship. And so, yes, let's go ahead and dive into acute grief. And so the first one is meditation. And so meditation is a fun one I like to do with most of my clients. And so when I first meet with our clients, I ask them about meditation. And usually they say, yes, I've tried meditation. It's not a good fit for me. I've tried it. It doesn't work for me. And so I ask them, well, what type of meditation did you do? Can you describe to me what you did? And majority say they sat still and try to just clear their mind and not think about anything. And I'll say, wow, that sounds intense. That's very intense. I can see why that was so challenging. And then I explained to them that there's 2 categories of meditation. There's the meditation where you focus on something, and then there's the meditation where you don't focus on anything. And usually the one that you don't focus on anything is meditation to the 100th power. Usually at that time they kind of laugh about that. But But yeah, there's two different categories of meditation. So sometimes it's about giving psychoeducation to our clients, even though they say, I've tried it, it didn't work, asking them, well, can you explain to me what you did? And maybe there's something that they did that was the reason why it didn't work. And so usually I do a simple meditation with them that helps them to realize, oh, I can do a meditation. I can do this, actually do this. And so the next one is music. We talked a little bit about that already. Playing a musical instrument, listening to musical instruments, listening to the words of the songs can be helpful. But again, being mindful that sometimes music can make us feel worse, depending on the genre. And sometimes clients might want to feel worse. Maybe they want to feel their pain, which is perfectly fine to feel their pain. The key is not to get stuck there, of course. But it's perfectly fine if they want to hear sad songs to help validate what they're experiencing on the inside. The next one is mindfulness. And so mindfulness is about being in the present moment, the here, the now. And actually DBT, dialectical behavioral therapy, it's a great approach to help with mindfulness. And so we're going to pause just for a moment to talk about mindfulness and the benefit of it. And so when it comes to mindfulness, let me see if I can get to that page. There's an organization I used to be a member of. They created kind of a cheat sheet book for mindfulness. And so what they talked about is this concept of self-soothe, the kit for first aid. So kind of thinking about when many of us might have a first aid kit in our car or a first aid kit somewhere in our house, or even there at the office, we have a first aid kit. And if someone gets a cut, we go to the first aid kit, get a Band-Aid, get some ointment, put it on, put the Band-Aid on to help soothe. And so the concept is kind of the same thing. So it says, using your list of things you've already identified to be soothing, building a ready-made self-soothing first aid kit at home or mobile use can be beneficial in times of unexpected crisis. The kit should be easy to use and carry. Things like envelopes, a shoebox, a crayon or pencil box, or a purse can often be ideal to create your first aid kit. So some examples they shared was pictures of the loved one or pictures of the pet who may have died. Place of relaxation. I know many times some of my clients will take pictures of things that they've seen online that was relaxing to them, maybe a waterfall or a beautiful space with flowers or mountains for some. And so sometimes having a relaxing picture can be very helpful for some. And then the next one is a reading material. It could be a joke, it could be a prayer. I know a lot of my clients embrace the serenity prayer. The concept behind the serenity prayer is accepting the things that they can't change. Accepting that their loved one isn't here and their loved one's not coming back in the same capacity that they were in their life. So the serenity prayer. Some people do jokes as well. Some people might have a mantra that they might read and quote to themselves. Another example is a helpful reminder to stay calm and manage the crisis. So it could be a statement saying, I can do this. I know another statement that a friend of mine used to say a lot was, I'm okay. I'm okay. I'm okay. And that helped them through those challenging moments. And again, these particular ones that we're talking about is during acute grief, when their emotions and their reaction is intense and at high levels. And then the next one is scents. So it could be lotion. It could be a certain type of potpourri that they might smell, or a spray of some sort. And so this is just an example of a kit for first aid, a self-soothing kit that is helpful for distress tolerance as well. And so at this time, we're going to go ahead and pause for a minute. I just want to see if there's any questions, and then we're going to take a break. So are there any questions? I'm going to go ahead and stop the share.
I'm not seeing anyone's come through since before.
Okay, great. All right, so we're going to go ahead and take a 10-minute break, and I will see you guys. All right, and so we're going to go ahead and continue on. And so we just finished talking about mindfulness. And so now we're talking about muscle relaxation. So with muscle relaxation, we're actually going to do this together. So just for a moment, I'm going to do a check-in with your body. On a scale of 1 to 10, 1, your body is completely relaxed. 10, your body's extremely tense. Go ahead and write that down somewhere or put it in the chat even, what your body feels like in this present moment on a scale of 1 to 10. Again, 1, you're completely relaxed. 10, your body's extremely tense. What number do you think you're at right now? Okay, so I see a 7, 5, some 7s, 5, some 3s and 7s. Okay. Yeah, so I want you to remember that number just for a moment and write it down somewhere. And so now we're going to try to relax our body as much as possible. I'm going to actually walk you guys through this. So we're going to start with some deep breathing, and then we're going to move into the actual muscle relaxation. And then we're going to end the exercise with some deep breathing as well. And so go ahead and breathe in deep through your nose and blow out slowly through your mouth. Again, breathe in deep through your nose and blow out slowly through your mouth, and try to empty all the air out. And one last time, breathe in deep through your nose. Hold it for a moment. And then blow out slowly through your mouth. So go ahead and let your breathing go back to normal breathing. And in this moment, we are going to try to relax our body as much as possible. So we're going to start with our toes. I want you to squish your toes up into a ball as tight as you can without hurting yourself. And then relax. Again, take your toes and squish them into a ball as tight as you can. And then relax. And one last time, take your toes and squish them into a ball as tight as you can. And then relax. Now we're going to take your knees and squeeze your knees together as tight as you can without hurting yourself. And then relax. Again, take your knees and squeeze them together as tight as you can. And then relax. And one last time, take your knees and squeeze them together as tight as you can. And then relax. Now I need you to imagine that you have a pair of lemons in your hands. I want you to squeeze those lemons as tight as you can without hurting yourself. And then drop them. Now you take those same lemons and try to squeeze all the juice out. And then let them go. Now take those same lemons one last time and try to squeeze every drop out. And then let them go. Now you take your shoulders and try to make your shoulders touch your ears. And then relax. Again, take your shoulders and try to make them touch your ears. And then relax. And one last time, take your shoulders and try to make them touch your ears. And then relax. Now try to relax your jawline. Relax your eyes. And relax the middle of your forehead. And if there's any area on your body that might feel tense or uncomfortable, go ahead and adjust yourself so you feel nice and relaxed. So now we're going to take a few deep breaths. We're going to breathe in deep through our nose and blow out slowly through our mouth. Again, we're going to breathe in deep through our nose and blow out slowly through our mouth and try to empty all the air out. And one last time, breathe in deep through our nose, hold it for a moment, and then blow out slowly through our mouth. So if you had your eyes open, go ahead and open your eyes. And in this moment, we're going to check in with our body again. So on a scale of 1 to 10, 1, our body's completely relaxed. 10, our body's extremely tense. What number are you at right now? And if you could just go ahead and place it in the chat. So I'm seeing a 1, some 2s, Fours and threes. Quite a few threes. Okay. And so it looks like quite a few has gone from sevens, eights, a three down to some ones and twos and fours. And so that took maybe 3, maybe 4 minutes to do. So imagine doing this with our clients. They're having an intense moment with anxiety or stress or feeling overwhelmed. That can put a weight on our shoulders. That can cause people's bodies to tense up. And so many times we carry our emotions in our body, like we talked about earlier, masked grief, how when we pile emotions up, it can come out in physical ailments. And so sometimes just simply doing a muscle relaxation can be very helpful to our clients. And whenever I do this, I let them know, hey, you did a type of meditation. I ask them, did any thoughts pop into your mind? Any intrusive thoughts? Usually they say no. So, well, good job. You did a type of meditation. You're able to clear your mind and focus on the present, the here, the now. What is your body doing? What does your body feel like? And so there's different types of variations to that muscle relaxation. There's one where there is a horizontal line. So it starts with your feet and the line goes up. And as the line goes up to your feet, your ankles, your calves, your knees, up to your thighs. And as the line goes up, you relax, or we encourage our clients to relax each of those muscles. And it gets to the top of our head, we relax the top of our head. And that line goes back down. And as it goes back down, we try to relax each of those muscles that the line touches. So that's just an example of a muscle relaxation. There's so many different ones out there. And I definitely want to encourage you to find the ones that resonate with your clients. You might try a couple of different ones as well. The benefit of that one that I like is, I tell my clients, you can do that anywhere. I probably wouldn't do the shoulder one, the shoulder part in public. If you might think you're weird or strange, might ask you questions. But if you're comfortable, go for it. But the muscle relaxation that we just did, we can do that anywhere, and no one has any idea what we're doing. But we're relaxing our body in that moment if we need to. There's been times where clients have been driving down the road, and unfortunately, road rage is an issue sometimes. And I've had clients share with me that someone cut them off and they got angry and they were able to relax their body to that muscle relaxation. And sometimes we're just relaxing the muscles in our face can cause the rest of our body to relax as well. So again, providing the psychoeducation to our clients and doing this in session with them can be very impacting as well. The next one is grounding techniques. So grounding techniques are basically bringing them to the here or the now. Sometimes when a client's experience traumatic grief, sometimes they can also experience dissociation as well. And so it's about helping our clients to come down to the present moment, the here, the now. And so quite a few of my clients, as interesting as this is, I'm sure there's some studies and research done on this, but a lot of my clients talk about whenever they're experiencing dissociation, when they immediately go to touch the ground, like the physical ground or grass, it brings them to the present moment, the here, the now. It helps calm them down. They feel like they're coming back into their body. And so sometimes simply having them to physically touch the ground can be helpful. I've even had a few clients, they literally asked somebody to pull the car over. They took their shoes off and just stood on the grass on the side of the road. And that helped them with their dissociation. And so, again, it's about finding those tools and techniques to help our clients when they're experiencing those intense emotions, those crisis moments, to help them bring it down to a healthier number. And so some grounding techniques, kind of going deeper into it, it's about our senses. And so kind of think about our senses, sometimes with their taste. I'll have a client put a piece of candy in their mouth, and I'll have them just explore the candy with their tongue. Find if it's smooth or rough in certain places, find the edges. And then I have them to notice their saliva. Maybe it increases in certain areas of their mouth. Maybe there's different tastes or flavors they can tell on their tongue. And then I have them take a bite, an intentional bite into the piece of candy or the piece of gum. And I have them take notice of the sound, notice of the increase in saliva, notice what part of the tongue might have been stimulated. And I have them then explore with their tongue the different parts of the pieces of candy now. Maybe there's several pieces of the candy in their mouth now. And so it's just being very intentional, inviting and exploring, inviting and exploring, just this back and forth. And that helps them to come in the present moment, the here, the now as well. The other senses, sound, hearing something, listening to something, relaxing. Sometimes people might put on a meditation before going to bed, because sometimes grief is really intense at nighttime, because that's when our mind is winding down, and that's when thoughts of the day happens. That's when thoughts of the loved ones who aren't there anymore many times will happen. And so nighttime is a great time to start listening to music to help calm our clients down if they need to. Another one is touch. Some people, they like to rub a rabbit's foot, something with silk. Sometimes people will play with change as well. That can definitely be a type of grounding technique to bring them to the present moment, the here, the now. And so again, a lot of these are about those moments where they're feeling overwhelmed, those intense emotions, and bringing them down. The next one is sensation shifting. And so this one is more about just being aware of the sensations in our body, such as those areas that are tingling and the feelings, the ones that are feeling warm, the places that are feeling pain and heaviness, just kind of being aware and going back and forth between those. Pendulation, this is actually one of my favorites, pendulations. So it is a somatic type of technique. For those who may not be familiar, somatic therapy is a body-based therapy. And actually, in 2020, the University of Cambridge, they put out an interesting article regarding how our body holds grief. And the article, it encouraged to move away from this concept of stages of grief that we just got finished talking about, and the concept of grief models, and to instead focus on the embodied experience of grief. And so talking about this particular one, pendulation, basically what we do is you have our client identify an emotion that they are having. So let's say they are feeling anxious, and they're feeling anxious because their loved one just died and they have 95,000 things to do, and they don't know if they can do all of it. So they're feeling anxious and overwhelmed. And so we have them identify, where in your body do you feel anxious and overwhelmed? So let's say they feel it in their chest and in their stomach. And then we ask them to identify any other emotions, maybe an emotion where they feel calmness or stillness or peace or joy in their body. And so let's say they say, well, I feel calmness in my feet. And so what we do is we have them to close their eyes, and we might have them do that muscle relaxation that we just did, depending on where they are. If they're at a 7 or above, we might have them do the muscle relaxation. Or if they're between a 1 and a 7 or 1 and a 6, then we probably won't have them do it. It depends on your client and how you want to move forward. But we have them identify that place, the emotion in that place, and then we have them go back and forth. So you have them to focus on their chest that is feeling overwhelmed. Then we have them focus on their foot that's feeling calm. Then we have them focus on their chest that's feeling overwhelmed. Then we have them focus on their foot that's feeling calm. It's just this back and forth. And then we have them focus on their stomach that's feeling anxiety. Then we have them focus on their foot feeling calm. Then they focus on their stomach feeling anxiety and the foot feeling calm. And so whenever we have them do this back and forth, it's very interesting to see. With all of my clients I've done this with so far, they physically begin to move. I physically see them swaying back and forth as I'm talking about going to this emotion and this place in your body. Now go to this emotion, this place in your body. And it's just this, it's very interesting to watch and to see. But there's several things that's happening in that moment. So many times whenever they come out of that space and I ask them, how was that for you? Most of my clients have said that the place of the overwhelmed and anxiety that they were experiencing has shrunk, and the place of calmness has actually increased and grown. And so that's very interesting to hear about. And so the other thing that it does, it helps them to realize that they have control. They have control over which emotions they want to focus on. Do I want to focus on the calmness, or do I want to focus on the anxiety? Focus on the calmness or focus on the overwhelmed. And so by us teaching our clients this in session, it helps them outside of session. When those moments pop up of them feeling overwhelmed, they can pause for a moment and say, you know what? I want to feel calmness. Where's calmness in my body? Okay, let me focus on this calmness. I see you overwhelmed. I acknowledge you. Now let me focus on the calmness. It just is back and forth, back and forth. So it's empowering for clients to experience pendulation. So I definitely encourage you guys to take a look at that. Again, that's some somatic technique that could be very helpful for clients who may not want to talk, may not want to explore verbally what's going on with them. And again, this is during the acute grief particular other experience. So intense, the emotions are intense and are high at this time. The next one's encouraging acceptance. So this is more about language. This is the verbiage that we use with our clients. And so it's about letting our clients know that denial does not make the loss disappear. The loss is still there, even though they're in denial. And then asking them, well, what does this denial mean for you? If we were to acknowledge that your loved one's not here, what would that mean? So just helping them to acknowledge some of those roadblocks and some of those fears that they might be having, and exploring those fears and seeing if some of those fears are rational or some of those fears might be irrational, and finding out how can we help resolve some of these fears. So maybe it's a mom who lost her husband. And so now she is the sole breadwinner. And she's not accustomed to paying bills, not accustomed to any of that. And now she has all this on her shoulders. And it could be overwhelming for her. And so she might be in denial in a lot of things. And so it's sitting with her and saying, well, what does that mean if he's not here? What would that mean? What would that mean for you in your life? Well, that means I have to take care of the bills. That means I have to take care of the children all the time, 24/7. And I won't have any time to do any coping skills. And I won't be able to see my friends and all these things that she can list. I won't have his companionship. I won't be able to talk to him about the stresses that happened at work that day. And then asking her, well, what's your biggest fear? My biggest fear is that we're going to lose the house. That's the second source of income, not only down to one source of income. I have a fear that we're going to lose the house. And so asking her, well, what are some resources? So that's us helping figure out how can we resolve this fear. It's a rational fear. It's definitely rational, but helping her resolve this rational fear. What are some resources we can connect with? So that's just an example of how sometimes just simply asking our clients, what is your biggest fear? What are the roadblocks to this denial that you're experiencing? And there are statements that can help promote acknowledgement. And so some of those statements, actually, there's a book that I'm going to refer to you guys, Counseling and Therapy Skills. It is by David G. Martin. Again, it is Counseling and Therapy Skills by David G. Martin. And in his book, just within the first couple of chapters, chapter 3, towards the end of chapter 3, he talks about empathic responses and leads and how powerful they can be. And so I'm just going to read just a couple of them, so that way you guys kind of get an idea of what he shares. But he says, so it sounds like you're kind of saying, and we repeat back what we hear our clients say. I'm picking up that you, and then we repeat back what we hear our clients say, or we repeat back maybe a feeling that they're implying but they aren't actually saying, to see if we're on the same page as them. Another one is, you must have felt X, Y, and Z. And so this is a really good one to use if our client is in denial. We might say something, wow, you must have felt distraught when you found out that your husband's dead. You must have felt distraught when you realized that you were going to be the sole breadwinner. So it helps reiterate, my partner's dead. My loved one is no longer here. I've experienced this loss. And so there are other things that we can do as well, or other statements that we can utilize as well. And so if you guys think of something different, put them in the chat as well. It's about us sharing techniques at this moment. But some other ones could be, if your loved one is here, what would, and then finish that statement. So it does two things. On one hand, it helps our client to realize my loved one is not here. And it also helps them to focus on what would I be doing, or whatever, however you want to finish that question. So again, it's, if your loved one was here, how would your life look different? Or what would you be doing differently? Or how would you handle the situation differently? Another statement is, I can't imagine how much your heart must ache knowing that your loved one's no longer here. How are you doing today? So it's, again, twofold. One hand, we are acknowledging that the loved one's not here. And we're also asking them another question for them to focus on something else. So there's just simple and empathetic and encouraging acceptance statements and questions that we can ask our clients to help them transition from this place of denial to this place of acceptance. And so it kind of goes back to absent grief. Individuals who experience absent grief, like myself, at one point, being asked a question of, what's life now that your grandma's no longer here? If someone had asked me that question at some point, I kind of would have been jolted for a second, like, wait, grandma's not here. I don't know what you mean by that. And so I'd have to pause for a second and then come up with an answer. And so sometimes you might see your clients do that, kind of pause for a second when you ask that question, because their mind hasn't fully registered that their loved one's not here because they're in denial, or they might be experiencing absent grief. And the last one I'll share is somebody asking, how has your life changed since their death? Somebody asking that question can be very, very impacting to them as well. And again, these questions can definitely evoke a lot of intense reaction, a lot of intense emotions. And it's about walking with our clients during this time, about letting them know that you're not alone. It's a process, and I'll be with you the entire way. And again, it's about going back to the coping skills as well.